So far, nearly 27,000 cases of monkeypox have been identified worldwide, and that number continues to grow. Since the beginning of the global outbreak, public health officials have struggled with the best way to share important information with at-risk people. Our Dr. Frank McGeorge here with a closer look at those concerns. Doc?
Monkeypox has not previously been viewed as a sexually transmitted disease, but this global outbreak is the first in which contact during sex appears to be the significant driver in the spread. And that's creating a difficult balance that health officials are trying to strike.
Warning an at-risk population without stigmatizing that very same population. That is the challenge with the 2022 monkeypox outbreak.
So the LGBTQ plus community historically has had a problematic relationship with the medical and mental health field.
Stephen Hayden is the founder of Envision U, a Denver-based nonprofit that seeks to close the gaps in behavioral health outcomes for LGBTQ plus individuals. Monkeypox is most often spread through close contact or sharing contaminated items. So far, the majority of cases in this outbreak worldwide are among men who have sex with men, but experts stress this can and has spread beyond one population.
When you closely associate a public health concern like this with a certain population, it does prevent folks who are not part of that population from seeking care.
Hayden says headlines matter.
The problem with that headline, again, is it's suggesting that this is a disease or a concern that should only impact gay men, and in fact, that's not true.
And history matters too, from the HIV/AIDS epidemic of the 80s and 90s to the modern-day political battles over LGBTQ plus rights.
Communities already experiencing some profound mental health challenges through stigma, discrimination, and targeted harassment. As you think about how do we target messages, especially around public health emergencies like the monkeypox, we need to be very thoughtful about how do we craft and target certain populations with messaging, how do we engage folks in a way that they feel safe and understood, and using culturally relevant and affirming language is essential.
Now, this is a prime example of why it's important to have more representation from the LGBTQ plus community in medicine and public health, to make sure that the desire to avoid stigma doesn't prevent good information from being shared, and that important health messages don't inadvertently make certain populations either the target of discrimination or of violence. Back to you.